22. Welcome back for your health now. While 2020 has no doubt been a year dominated by COVID-19, we've also seen a spotlight placed on types of cancer, whether it be the deaths of Chadwick Boseman or Alex Trebek due to colorectal and pancreatic cancer, or the recent reveal of prostate cancer by Today Show meteorologist Al Roker. But even as these headlines increase awareness about the diseases, doctors say there's also been some negative trends as well. A recent survey by the Prevent Cancer Foundation found that more than a third of Americans, about 35%, missed scheduled cancer screenings due to fears over COVID-19. Now, that same survey says an additional 43% of Americans have missed medical appointments this year. If that wasn't enough, about 22% of people who had routine medical appointments or screenings scheduled said they planned to postpone or cancel. We spoke to a urologist with IU Health who told us while some people may believe a missed screening is something that can simply be handled down the road, when it comes to those who have cancer, early diagnosis can completely transform treatment and outcome.
The goal with cancer is first to catch it in time for a cure, but then secondly, the earlier you catch it, usually the easier the treatment is, the less aggressive the treatment has to be. And so that's always the goal. But now there's a competing risk with COVID that's real and that you have to take into consideration.
Dr. Baylor also says it's important for those seeking medical care to keep in mind the efforts the healthcare community is making to isolate COVID patients or those seeking COVID testing.
The healthcare systems are trying to separate the folks that are working through COVID from the healthy folks, so that screening is often done off-site at a drive-through for COVID. So there is an effort not to mix folks who are sick with COVID getting better from it and those who are just trying to get their routine medical care. But when we look at a patient, that's a real concern. Obviously, we want to take COVID seriously, and as we've heard over and over, for those that are dealing with severe heart disease, lung disease, or obesity, they're at particular risk, and especially those over 70.
Baylor says bottom line, information and early information about any particular case is one of the best weapons you can arm yourself with. Simply put, he says the earlier you identify the problem, the more options you have and the increased likelihood of a better outcome.